It's really a moral imperative that we do not harm kids when they come and they're brought in by their families for us to take care of them and keep them safe. And we have united around that cause and have been successful in almost eliminating everything down to zero, which is our goal. We are announcing a Leapfrog Top Children's Hospital Award. This will be our 5th award. So for us, it's a very special event. It separates us out from the rest of the children's hospitals in the country and makes us one of the best.
Receiving the Leapfrog recognition is an astounding achievement for the team, mostly because it does highlight the quality and safety components that we strive on and deliver extraordinary care to our patients.
Leapfrog was formed about 25 years ago over concerns over quality and safety in healthcare. It's based on objective criteria such as elimination of hospital-acquired conditions, things like central line bloodstream infections, catheter-associated urinary tract infections, protection of children against overuse of radiation in radiology procedures, things like that. So it's all objective criteria, as opposed to other surveys which are more subjective.
And from our nursing team to our physicians to our volunteers to our clinical staff, support staff, it takes the whole team to deliver that. So it's just one more acknowledgement of excellence in the care that the team delivers. Our patient and family feedback is critical to what we do. I think that's what is most meaningful to our teams, in that we want to deliver the high quality and reach those expectations of the care outcomes. But if we don't deliver the family's expectations, we're kind of missing the mark.
My son is a pediatric brain cancer patient that has been blessed to have the treatment and care here since March 13th of 2021. Every 2 weeks he looks forward to coming because the Child Life team makes him feel welcome. The nurses know him by name.
I think if you were asked parents what's important to them, they want, number one, their kid to feel better. And number two, they want us not to harm the child while they're here. The other accolades that hospitals get for reputation and maybe research and academics are important, but ultimately what we care about and what the families care about is how their children are taken care of and kept safe in the hospital.
It just puts that reassurance of trust that I know my son's in the best care. And when we're talking about safety, I'm talking about from the minute you check in through the ER, through oncology, even through the front desk. It's just literally like a process, but it's a process to where you don't have to think about it. The doctors are aware of his diagnosis. They get him through where he needs to go, even down to the pharmacy releasing his medications on oncology days for his infusions. As a parent, that's like one of the least things I have to worry about. And it just reassures me that, again, that Zeke's in the best care. And the fact that this is in my backyard is just really heartwarming, man. It just makes me feel like my son's gonna keep pushing and keep fighting as long as he can. From my family to Valley Children's and all the staff, it is with sincere heart that we appreciate you, and without you, none of this would be possible.